in a short period of time address. We certainly, as I just articulated, have included that into our analysis of these waivers and are continuing to look at, as I mentioned, the rates in home care services, and happy to share that information with you as soon as that rate analysis is complete.
If we could just go back to brain injuries, refresh my memory as to how many people were housing out of state. I remember from a couple of years ago, but
Yeah, and I know that we have begun the process of bringing individuals back. I don't know how many at this point we've been able to relocate. I know Gary Walcott is, how many out of state today?
Today we have about 3 dozen.
about 36.
36
Yeah.
individuals.
That's mostly New Hampshire from what I remember, right?
But we have a plan to bring all of those individuals back to Maine. I don't know if our timeline has changed, Gary, what we were looking at.
We're still hoping for June.
June.
But
Representative Melody, did you have?
No.
No. President Ivinson?
Thank you. Just to clarify Representative Gattin's concerns, the rate analysis for home-based care isn't available, and you assume, as everyone does, that that'll be an increased amount. And this budget is built not based on those assumptions. Shouldn't there be a pad somewhere in anticipation that the number's going to be higher? Am I missing something?
Well, it's not, obviously, as I mentioned, there are a number of areas in the Medicaid program that we believe also need to be addressed. Our challenge is to bring forward, the governor's challenge is to bring forward a balanced budget and to try and address as many of the priorities that we believe can be addressed reasonably and appropriately. The rate study has been commissioned because we share the concern about the need to improve and support the direct care workforce. We have worked with a consulting firm that is conducting that analysis so that it is thorough and comprehensive. And I intend to share the results of that with the governor and talk about what options we have at that point.
Okay, I look forward to that discussion.
And Commissioner, in looking down, reading ahead, we've got a bunch of basically personnel transfers. Give you the opportunity to highlight instead of reading each individual one.
Happy to?
One more. Representative Gattin.
One more multi-part. No. Commissioner, thank you for the, again, I think the questions I'm asking are really, based upon the fact that I continue to share the desire to serve these people and find funding. And I just want to make sure that we understand the cost as we work through the costs. With respect to the high needs people that we talked about a second ago, ALS and people with Huntington's, again, Representative Mallory has a couple of bills. Senator Bradford has a bill in front of our committee. One of the things that would be helpful for me at the work session would be, again, any information the department has about what the overall number of people and what the needs are. So as you guys are looking at this, what are you really targeting in terms of the number of people that would benefit from the service, so that we can figure out what would be needed budgetarily and what we might need going into the future.
Melody? Representative Melody?
Yeah, thank you, and thank you, Commissioner, for these initiatives. And just a brief response to Representative Gattin is that you recently signed off on a new rate for ALS, or vet patients.
Vet patients
And that's moved into the APA. Thank you, and thank you for that.
You're welcome. So do you want me to still review each of these position transfers, or?
I'm giving you the option to, is it necessary to read each transfer, or?
Well, let me see if I can highlight then more significant.
I know I threw you a curveball.
No, I never get those, so let me see if I can.
Knock it out of the park.
Mm-hmm. Let me take you to page 10. Within the Office of Child and Family Services, I do want to draw your attention to a number of proposals that are a little more significant related to general fund requests. So this is on page 360. And it is seeking $746,930.16 and $757,768.17. This initiative reallocates all positions in the Office of Child and Family Services Central Program from 61% general fund and 39% other special revenue funds to 72% general fund and 28% other special revenue. Title 4E is the federal program that provides funding for an eligible child up to age 21 placed in foster care. Title 4E federal funding provides limited services, including such things as maintenance payments, child care, clothing allowance, and tuition reimbursement to children in state custody, while permanent plans are being made through family rehabilitation and reunification. The overall costs of the program have not changed, but due to the changes in the mix of children eligible for Title 4E and other grant funding, the department will be receiving fewer grant dollars through Title 4E, which is necessitating this request for additional general fund resources. Let me continue.
Senator Haskell, any question?
You said the mix of clients. What's the demographic of those mix of clients that's changed this?
It's and I want to get you the more detail, but there's a certain eligibility requirement or a income level that is applied as to whether or not the child is eligible for that Title 4E funding. So the number of children that are eligible for the Title 4E has decreased, but we can get you that.
Because they've met the income levels.
Yes,
The federal income level.
federal, under the Title 4E. Further down that page, page 363 and 374. This is, again, a transfer from the Commissioner's District Operations to the Office of Child and Family Services. And it is requesting, it is transferring those funds. So this initiative transfers and reallocates 28 Office Assistant 2 positions, 4 Office Associate 2 positions, 3 Office Associate 2 supervisors, and 1 Accounting Associate 1. And again, you can see the split of moving those from one area of the department over into the Office of Child and Family Services. Let me, again, the next initiative, page 363. This initiative reallocates all positions in the Office of Child and Family Services District Program from 77% general fund and 23% other special revenue to 82% general fund and 18% other special revenue funds in the same program. And you can see this is a request of $3,718,000 in 16 and $3,780,089 in 17. Again, Title 4E, I've already walked through that. The OCFS also receives federal grant funding for personnel related to Title 4E expenditures. Due to changes in the children being served and the eligibility, the department's grant funding has decreased, and we are receiving fewer grant dollars, again, which is necessitating the need for these additional general fund resources. That was one that I wanted to highlight.
Representative Martin.
This reminds me of the issue we had on allocation for clothing and all the other issues 4 years ago. Is this a continuation of the decrease of those dollars?
No. It is more that of the expenditures covering the cost of OCFS personnel and the services and supports for the children. We are not able to leverage the amount of the federal grant funding as we previously had. And again, we can get more information about those specific requirements.
So as a percentage of the money has changed in the allocation from the 4E funds? Or
Yes.
simply
Yes, and reverting more to the general fund.
and so we have to pick up more since
Yes.
the 4E funds are not coming?
Yes. Because of the eligibility of the children, not because there's been any change in terms of the federal funding levels, but the eligibility criteria. Maine, and I know we shared this with the legislature previously, there had been an audit many years ago where children were being, funds were being drawn down under Title IV-E inappropriately. And again, this is just continuing to reflect changes necessary.
Representative Stuckey?
So I think I just got the answer, but the changes are not they're on the ground, but it's the same population.
Yes.
I mean, we haven't seen a shift of the clientele, the state residents, or I mean, there's no change there. The change is in the interpretation of eligibility from 40.
Yeah, I want to just take a look. Obviously, we've talked about in the past the importance of ensuring that we're using the Title IV-E where appropriate, consistent with the audit from years ago. I want to take a look and provide you with the data that really breaks down those eligibility requirements and how that is applied.
So so the demographic of the kids that are in the program, there's not a big shift there.
No, no. Further down the page, page 338, this is the request based upon the forecasted need for the Office of Main Care Services. This initiative provides funding in main care and main care related accounts to make cycle payments and payments to providers. So the request in 16 for additional general fund above the baseline, assuming no other changes were to occur and solely based upon a forecast of expected increases in utilization and cost. The general fund need for 16 is $7,801,624. And for 17, it is $6,318,369. The requested funding would cover the structural gap that the department is forecasting between resources available to fund main care versus projected program need over the biennium. The $14.1 million the department is requesting represents less than 1% of forecasted expenditures in fiscal years 16 and 17. And just to put this in perspective, a weekly cycle payment for main care is a general fund is about $15 to $17 million.
Representative Martin?
Thank you. Commissioner, are you saying that we are presently behind in making payments?
No.
For one payment?
This
One
is just
cycle?
in preparing the biennial budget, looking at our baseline that's established for 16 and 17, and what we forecast for any changes, pharmacy payments that would be hitting in 16 and 17, or
So you're assuming that there will be a greater need for main care in the next 2 years?
we're saying that the baseline budget does not reflect forecasted additional costs that we see in 16 and 17.
You're saying the same thing?
I hope so. So the object code information that we provided recently that goes line by line to the top 25 object codes for hospitals, residential. So we've analyzed all of those, the seasonal variations. This goes through that forecasting model that we've talked about the whole winters.
So if I put it another way, it means that we're anticipating potentially an increased demand on each one of the lines as we move forward.
But it may not be just demand. So we've talked about, as an example, the new Sovaldi, the new, is it Hep C drug, and the increased cost there. We try to anticipate what may be happening based upon information that we receive from Google Health Systems on the pharmacy side of the equation. It also does include any demand side that may be also affecting the overall budget for main care.
So if I put it another way,
Happy to hear it.
you really want this money so that at the end of the fiscal year, you don't have a deficit?
Thank you, yes.
Thank you.
All right.
So I'll get there. Representative Sanderson?
Thank you, Mr. Chair. Commissioner, does this Is this part of the initiative that covers the fact that how the calendar lies, we're going to have 53 weeks versus a 52-week
Yes,
commitment
in 16. Yeah.
in 16? Okay. Thank you.
Representative Gattini?
Thank you for that question, that answer. But again, Commissioner, you kind of flagged it, there's two sort of major categories, right? There's potential changes in utilization, and then there's potential changes in cost. So, I mean, would it be possible to get, I mean, there would be some assumptions, right, you know, built into that, you know, that were used to build that up, besides simply the holding through this algorithm. Is that something that you could provide for us?
Well, I'm not sure what you mean by besides the Hope Winters algorithm. I mean, that obviously is a huge part of the analysis of each of those object code lines. And so you have seen the forecasting document with the various lines and what's been spent historically and what is forecasted for 16 and 17. We'll certainly get that to you again.
But again, if you were anticipating a rate increase in a certain service, right, that would be an input into the forecast. And if you,
It would either be a rate increase or in the forecast assumptions, or it would be a budget initiative that we've presented to you in the biennial.
and I guess that's the second question that I had is this is a general question. You know, again, as we've sat here this week, we've seen areas that reflect pricing increases, increases in cost of services that are brought forward as separate initiatives in the budget. But then there also seem to be, you know, rate increases, you know, changes in policy that impact costs that don't, Representative Malady alluded a second ago to a change in rate for people with ALS. I mean, how does the department, what are the factors that drive the department's decision whether they're just going to do something through the APA process and bake it into, you know, the payments that they're currently making, as opposed to something that they're going to bring to us in a supplemental budget or in our biennial budget. I guess as I've sat here for a couple of years now, I've never really understood, you know, how the department makes those distinctions.
Well, as you know, it's a $2.4 billion annual budget. There is certainly authority within the executive branch to manage that budget. That's why the legislature has provided authority for the transfer of funds among several of the accounts to ensure that payments to providers are met. There are also provisions currently within rule that certainly date back many years related to extraordinary circumstances and opportunities to address urgent needs with nursing facilities in particular that allow for that flexibility. As you know, there are reams and reams of regulations governing the main care program, all of which we comply with in assessing whether or not we can move forward with a rate of increase, whether it needs to go through a rulemaking process or whether it needs to be brought before the legislature in order to seek the necessary funds to support that particular rate. There is not one standard answer, Representative Gattini, because of the variety of laws and budget initiatives that have been passed and regulations that have been passed.
Senator Haskell?
The assumptions were my question. The assumptions were my question as well. I'd like to just see some of the assumptions, and I'm assuming it's not in this fact.
I'd have to take a look at what was provided, but I think we shared when we did the orientations for both of the committees a number of documents related to that. But if those did not go through 16 and 17, we will get those for you.
Thank you.
Representative Hymanson?
Thank you. Just because I'm a newbie, and I'd like to understand which funds can be transferred. Is there a document that talks about where the fund transfers?
The statutory language, sure,
Yeah.
we can get that.
Great, thank you.
Just looking for what else to draw your attention to.
Representative Sanderson? Or Sanborn?
Thank you. Just mentioning the statutory piece rang a bell with me because when do we have to really follow what the statute says? For instance, I know the Fund for Healthy Maine says that you can use those monies to supplement but not supplant, but we keep supplanting. So when do you have to be held to the law about the statute?
I'm not exactly sure I understand your question. What we're proposing is to change the law, so that's why the budget is before you. We're always complying with the statutory requirements. Anytime we're looking to change that, it would be in the form of a bill or in the budget. I guess I would draw your attention to, on page 14, on page 314 of the budget. This is within the Division of Licensing and Regulatory Services. This initiative continues 13 limited period community care worker positions, 2 limited period social services program specialists 2 positions, and 1 limited period office associate 2 position in the Division of Licensing and Regulatory Services. These positions inspect and license child care facilities across the state to improve quality and safety of the early learning environment for children. These 13 community care workers, 2 social service program specialists, and 1 office associate 2 are necessary to maintain the caseload per inspector at the national average of 80 cases per inspector per year. And again, this is using other special revenue, but I did want to just draw your attention to that.
Representative Martin?
Thank you, Commissioner. I'd like to have your attention go back to page 12, top of the page, the FMAP. Is that presently our rate, or is that the anticipated change rate?
So that is the, will be the rate in state fiscal year 16. As you know, that is done on a federal fiscal year.
Right.
And then for 17, it is the forecasted rate.
So this is not a rate today, this is the anticipated rate for October.
Exactly, that will occur in our state fiscal year 16.
Thank you. Yeah, so it actually comes back 1 quarter after our
Right.
fiscal year. Thank you. And just one, I'm sorry, and on page 14, I don't know if you're going to make reference to it, but someone's going to be going from range 38 to range 90, page 371.
Yes. This initiative provides funding for the range change for 1 deputy commissioner position from range 38 to range 90 and transfers all other to personal services to fund the reorganization. The deputy commissioner program position oversees staff, and the staff that are being overseen are at the same range as the current range for the deputy commissioner programs.
And it's going to cost us 0. Where is the money coming from?
We are transferring it from all other to personal services. We can provide you with more detail on that.
And so you have it anticipated the all other accounts will be sufficient in order to
Yes.
pay for that?
Yes.
Thank you.
There is another large initiative that I just saw that I want to draw your attention to. On page 12 of my testimony, midway down the page, and this is in the budget, page 307. This is requesting general fund dollars of $2 million in 16 and $2 million in 17. This initiative is providing funding to eliminate a department-wide reduction, which originally was intended to be one time in Public Law 2013, Chapter 368. It was enacted as a reduction to meet then immediate budgetary needs of the state. This reduction was intended to have been only in 13, but has carried forward and has affected our permanent baseline. I believe that captures the significant requests pending before you today and identified in our testimony.
Representative Grant?
Thank you, Mr. Chair. Thank you, Commissioner. Going back to the page on page 14 of your testimony that Representative Martin was asking about, this this is a range change for a position that already exists, a deputy commissioner position.
Yes.
Where is that in your org chart that you gave us? Do you know, is that in the
Deputy Commissioner Programs.
programs? Okay, so that's the person that would report to this currently, I don't know if it's filled or not, reports to Mr. Martin?
Nope, reports to me. The Deputy Commissioner Programs reports
Okay.
to me and oversees the Office of Child and Family Services, the Office of Substance Abuse and Mental Health Services, the Office of Aging and Disability Services, the Office of Multicultural Affairs.
So this position already
Two state
exists?
psychiatric hospitals, right?
The deputy already exists?
Yes.
Okay.
Yep.
Representative Bursey?
Thank you, Senator. Good morning, Commissioner. I was wondering, could you pull together a comprehensive list of wait lists? Being a newbie, I've got this wait list for this and that and something else, and how many people are on it. And I know it changes, but whatever the current one is.
Sure.
Like, thank you.
Of course.
And Senator Haskell?
Thank you very much. Good morning. Can I assume that in the orientation package, which I'm sorry I did not take home and study for several hours, has an org chart in it of your administrative office so that I can understand these 100 positions that are being, those are across the whole department. But I'd like to know which ones are coming in and out of the commissioner's administrative level. Is that in that orientation package?
Is the, so you have an org chart, I'll have to take a look at what level of detail you are seeking, and of course the administrative offices, I hope it's understood, includes more than the commissioner's immediate staff. That includes the Division of Audit, the Division of Contract Management, our financial staff, so happy to provide you with more information on that. I think you received a detailed list from DAPS on the vacant positions. That was a statewide request made of all departments. And so I believe you have the detailed information on those positions, and we'll look and see what we can provide you for further depth in the organizational structure.
I'd appreciate that.
Sure.
Thank you.
Representative Gootee?
Thank you, and Commissioner, you did provide us a pretty detailed org chart. But I'm assuming that some of the changes you made in CDC might have, my understanding is that you've moved Dr. Panetta up to a position in the Commissioner's office. I guess I'm saying if the org chart needs to be updated, I'd love to get a copy of
We'll
that.
get you an updated copy. Sure.
Thank you.
Representative Martin?
Thank you very much. Your last initiative, which you didn't refer to, eliminates 100 positions for various accounts within the department. I've gone through that list. The ones that sort of strike me as being a potential problem down the road are those in CDC. And so I wonder if you could provide the old chart and a new chart conception of what CDC is going to look like.
Sure.
And so, you know, I'm not sure, and I don't make an assumption as to what could happen, but so I'd like to see what it is before I make any comments.
Right, and again, while it does not say that, those are vacant positions, but yes, we'll try to provide you with current and future state.
Yeah, and if you could sort of, there could be some that you are still going to be vacant, but you keep them and show those as well.
Yes.
What will it look like once it's completed?
Happy to try to do that, yeah.
Representative Rotunda?
Thank you, Mr. Chair. Commissioner, I know this is not the first time you've heard me ask about the public health nurses and the fact that in the Rosen report they were slated to be, many of those vacancies were slated to be taken and not filled, and we restored funding for them. And hiring has not taken place for many of those positions, and I'm just wondering why that has been the case and why you're choosing not to fill those public health nurses.
Representative Rotunda, yes, you've asked before, and I think I've answered as well. We are focused on ensuring that there is an efficient alignment of staffing related to the need and the demand. The positions that you reference related to public health nursing, there are also a number of contracts for contracted public health nurses in the community. Our focus is evaluating where the need is and ensuring that we have the right staffing supports to meet that mission. We are looking at a variety of needs related to children that have been born drug affected and repurposing and reprioritizing public health nursing and supports to target some of those critical public health needs.
Thank you, and I guess the reason I keep bringing this up is that in Lewiston and Auburn, where we are down significantly with public health nurses, there is an enormous need, at least according to people who are providing public health in the community. And so it sounds like where people are in disagreement in terms of what the level of need is. And you know, the fact that the TB nurse has not been replaced, and there's some significant holes, it feels like, in our public safety net around public health. And we feel in our area it's extremely frayed, and we really worry about what would happen if there was some kind of outbreak. People are stretched to the max, and people have not been replaced regionally as well as within the area.
Yeah, I do agree. We probably disagree on some of the issues related to that. And again, there's a public-private engagement around those services, and happy to follow back up as we look at how best to structure those services.
And perhaps you could share that with the public health nurses, because they are not aware of any public-private relationship.
I think they are aware that there's a contract for services for public health nurses, and we've been working very closely with a number of the public health nurses.
Thank you.
Question, Representative Grant?
Thank you, Mr. Chair. Commissioner, I would just reiterate what Representative Rotundo has raised. I've heard from a number of folks who are really concerned about public safety, especially around infectious disease spreading. And I understand what you're saying about targeting specific needs, but I don't know how you do that with less staff. And I'm concerned about the issue of contracted services versus a cohesive system of public health that has department employees respond to particular issues, whether it's drug-affected babies or TB outbreaks or Ebola, for example. And I'm really concerned about this direction, and I would love to know why the department is going in the direction of contracted services as opposed to filling slots for the public health nurses that we've had in the past.
I believe I've responded. Happy to provide more information. We are looking at ensuring that we have the right staffing structure related to the need, related to the demand, evaluating the efficiency of the structure. There have been contracts for community-based public health nurses. We want to make sure that we've got a comprehensive approach that both maximizes that role along with the state-employed public health nurses, that we are looking at the day in the life of a public health nurse, and that we are effectively maximizing those roles and responsibilities.
Hello?
Thank you for the follow-up. What I'm hearing from day in the life of public health nurses is that they're traveling from one end of the state to the other to try to cover a very large geography. And I haven't, though you've answered the question in various ways, maybe I'm not phrasing it correctly. I'm wondering why it's better to have contracted services, why it's more efficient than it is to have a collection of folks who are dedicated to public health nursing in the department.
And maybe I didn't answer as clearly as I needed to. The issue is whether or not that number of public health nurses is necessary based upon both the demand for services, the role that they're playing, and the private, the contracts that have existed around community-based public health nurses. And so we are continuing to review and evaluate and make sure that we've got the right alignment of staffing to meet and appropriately respond to the public health expectations.
Yeah, I'm just trying to understand. So what I think I hear you saying is that with a contracted community-based service, you can be more flexible or you can be more targeted.
No, I have not said that. Our job in this department, as I would expect you would hear from any department, is to make sure that the resources assigned to us, that the operational needs effectively are reflected in the staffing complement, that we are constantly evaluating what the services are that need to be provided, how those are organized as effectively as possible, and that we are continuing in a culture of continuous process improvement to ensure that we've got the right alignment of staff to support the role and responsibilities.
Representative Martin?
Thank you. I guess, since I've heard the same criticism in Aroostook County, I'd like you to put together how is Aroostook County presently covered? What are the contracts that have been made and with whom? And how is that, and whether or not there are state nurses and what role they play with those contracts that have been made. Because I'm getting the same kind of pushback that others are getting. And I'm not saying that the coverage isn't there, because I have no clue. I mean, I belong to, I'm president of a health center where we provide services to the local schools, but we have no contracts with the state to provide any kind of services beyond that role. So I don't know what's going on outside of that area, and so it might be helpful. And because my understanding from what they were telling me is that they were under the impression that the legislature last time had appropriated funds to fill those positions. And apparently I'm hearing that those were not filled. Am I correct?
I don't know what you've heard, so.
But any of those funds, any of those positions filled last time that were authorized by the
Well, the legislature also authorized that the department maintain a 6% attrition rate. So as part of our overall requirement to achieve personnel services savings, we also have to manage our attrition rate in order to produce those savings. So I'd have to certainly take a look at both the combination of that. You rejected